Paul George of the 76ers leaves the game with what is being reported as a knee hyperextension injury. Welcome back, everyone. My name is Dr. Stephen Wilson, and here on this channel we analyze the mechanisms of sports injuries. So if that's the type of content that interests you, then please consider liking and subscribing to the channel. The replay from tonight's game between the Sixers and the Hawks, it's not very long here, but we're looking at Paul George. He's the defender, and when he's defending, he gets bumped there at the top of the key, and then his left leg comes back and plants right there. So what we're looking at is Paul George's left leg planting. That's where the injury occurs. So right before that, when his left foot is on the floor, we can see the angle of his leg here is relatively straight in a normal anatomical position, but a few moments later we can see his left knee, how it starts to hyperextend and almost bow backwards. In this position, I want to draw your attention to his left foot. Right here, we can see how his left foot is pointed at an angle to his outside or to his left. His left foot is in what we'd call external rotation. Therefore, there will be a rotational component going through his lower leg and up into his knee. Now, we can easily visualize how his lower leg, his tibia, is actually moving posteriorly or behind compared to or relative to his upper leg here, his femur. When that happens, that's going to stress the connective tissue in the back of his knee, mainly the joint capsule, his posterior cruciate ligament, his PCL, his ACL, his anterior cruciate ligament. But with his foot at an angle like that, that can also stress his meniscus and perhaps his lateral collateral ligament, because with his foot in external rotation, that's also going to put a rotational stress through his knee, stressing the outside and back portion of his knee as well. We'll take a look at exactly what's occurring here with the anatomy screen, and we'll correlate how his knee hyperextending and bending backwards like that, and then we can appreciate the actual anatomical structures here. So here we see an anatomy model of a left leg. This is the skeleton. So at the top here we have your pelvis, then we have the long thigh bone of the femur, and then your shin bones, your tibia. Right beside that is your fibula, and then of course your ankle and your foot here. So we can actually rotate it around and we'll get a look from the back side here, and then from the outside, this is the lateral view. So we're just gonna zoom in here a little bit. So this is the outside of, let's say, Paul George's knee. And when he plants his left leg, what was occurring is his left foot was in slight external rotation, and therefore the stress of hyperextending his knee is going to be on the back portion of his knee right here, with the movement and the motion going this way. His knee is going to hyperextend backwards. It's almost going to bow out almost a little bit like this. So what that's going to cause is tension and stress to the soft connective tissue to the back of his knee, mainly the joint capsule, his PCL, perhaps his ACL, and even his lateral collateral ligament as well. But in the front part here, his tibia, the plateau of his tibia and the front of his femur are going to bump into each other. It's going to create almost like certainly almost like a bone bruising in the front of his knee, which is going to be very sore for Paul George. And then again, we look at the knee from the front. This is the anterior view. At the top here, of course, we have your femur, the thigh bone, your kneecap, your patella right here, and then your tibia and the fibula right beside it. So those ligaments that we were referring to is your ACL, your PCL, your LCL, because of that rotational component that appears to be occurring in Paul George's knee, and then the meniscus that runs, that's the soft cartilage that runs right through the middle. Those structures will all be susceptible to injury on this play. In the near future here, Paul George will have imaging done on his knee. I hope you have a great night. Thank you for watching.